We come to the Monash Children's Hospital because in 2015 Zach was diagnosed with a brain cancer. There's about a 1 in 3 million chance of having this particular cancer, which means there's actually not a lot known about it. There's not a lot of people in Australia or worldwide that have been diagnosed with this tumour.
I'm going to be off talking to a family today. They don't know it yet, but their child has a really serious tumour. Chances of being cured are not that great. But what I'd like to be able to say in the future is that, yes, your child has this really serious disease. We actually understand it a lot better, and the treatment is going to cure her. It's going to get her better with minimal side effects.
We know that the funds that we invest into hospitals and research institutes are changing lives. It doesn't happen today, probably won't happen tomorrow, but we know it does have an impact, and it's enormously satisfying to understand that the work that we're doing really does make a difference to children with cancer.
A patient comes into the hospital and their tumour will be taken out by the surgeon, and we will receive a part of that tumour. We will grow that tumour in our tissue culture facility and expand it. Those tumour clumps, or the organoids, will then be screened with libraries of about 1,000 compounds. When we identify a particular compound that those organoids are sensitive to, we will relay that information back to the clinical team, offering that patient that specific treatment that we identified using the organoids.
The potential to improve the quality of life and improve survival rates in paediatric cancer is enormous. We can take these cells, we can test them and identify a specific therapeutic approach to each individual patient.
If we can achieve this, and it might not be in the next year or two, but certainly all these types of studies and research programs that are going on are feeding information into that wider program of developing this type of treatment. So for us, that would be incredible. It means that we could hope for a cure, but we could also hope for a cure that doesn't come at a high cost to his body into the future and his development into the future.
And this is really an Australian first program. So using these organoids, we can go beyond just identifying whether a particular mutation exists, but ask for any particular patient, whether they have a mutation or not, can we identify which therapy will work best for that patient?
Zach says that he would like to be a doctor. He says that he'd like to be a sleep doctor in particular. So he would like to be a anaesthetist because he went through 30 sessions of general anaesthetic every single day. And
more of them.
Yeah. And he decided that that's what he would like to do, and he'd like to help other children that have cancer to go through that process as well.